My name is Bill Chun. I'm a board-certified OBGYN. Complications related to older mothers having babies, 35 and up. It is true if you consider that there is the higher incidence of miscarriage, tubal pregnancy, and older mothers are going to have more of medical complications from hypertension to diabetes, which may contribute to higher incidence of induction, therefore higher incidence of cesarean section. Now, that doesn't mean that just because one is at risk of having more complication that you should have babies early. I mean, when to become a mother is so personal. I personally waited at the age of 37, and I became a father again at the age of 49. And my wife delivered at the age of 42 for the first time, set her twins. The reality is, older mothers, while at risk for more complication, do well. For the most part, outcome is good. Why are older women having more C-section than younger ones? One, they have more of medical complications. So there are conditions such as hypertension in pregnancy, which may warrant induction of labor. And as you may know, induction of labor does make or does contribute to cesarean section. Now, if Mary, who is 43, have tried 6 months or 2 years to get pregnant, finally pregnant for the first time, finally after finding that Mr. Right, and she's pregnant, and she's having these issues, she wants just the right outcome. And then if her OBGYN says, you know what, I'm a little concerned because your baby is not just as big as it should be. We can watch because the amniotic fluid is normal. We're going to continue to watch. But I think maybe 2.5 weeks or 3 weeks before you're due, we should consider doing something. Now, then Mary may say, you know what are my options? Trial of labor? You mean so you're going to induce my labor? Or can I just have a C-section? Because I really don't want to take any chance. Now, you see how that scenario could end up with a C-section. So women who are over 40, cesarean section rate is over 50%. Now, I would tell you, if my wife or somebody who's asked me about prenatal care, it starts with, before getting pregnant, get healthier, reduce your stress, somehow you get pregnant naturally or artificially, you get to that place, and then shop for just the right doctor. And then throughout the prenatal care, you just got to really communicate with your doctor and say, look, I don't have any reason for cesarean section. I like to be, maybe 1 out of 5 chances I end up with a C-section. But unless there's a reason for, I really want to go natural. Rather than being a passive participant, I think you really have to be active and say, this is what I want. And then you find the right doctor in the right hospital. And then you go from there. But this cesarean section rate in this country, it's scary. And it's not going to reverse anytime soon. And soon it will be 1 out of 2 babies. I think there are a few reasons as to why older mothers are having cesarean section. Again, it is because they are at risk for more medical conditions. And also because these are women, look, you wait all those years to be a parent. You can understand if the patient says, I really don't want to take any chance. And from an obstetrician standpoint, you know what? I really don't want to take any risk. I know that baby's head is right there. I can help her push maybe 2 more hours. Baby's heart rate tracing is a little concerning, but I can really stick with it. And maybe I can do vacuum delivery. Or, I don't know, man, she seems a little anxious. Who wouldn't be anxious if a person going through several cycles of IVF, after all those injections, if Mary waited, you know what, I waited and waited for the right guy. He's the right guy, and then I finally get pregnant, and I find out that I can't get pregnant. I go through all this trial, I finally get pregnant, and my doctor tells me, that my baby's heart rate is a little concerned. It's good, no emergency, but he wants to really keep a close eye on. At any moment, I may need a C-section. Do I really want to do that? Or just have, I want to hold that baby girl in my arms? So you can see why C-section happens 2 out of 3 or 3 out of 5 cases. So in some ways, you can't blame anyone. I think older women or women over 40 particularly should shop for just the right doctor. Why? You're wiser. You are more needy, if I may say. You are, this is the truth. You know what you want. So it's like you use a recipe to try out a new dish. Oh, I thought it was going to turn out, but I must have missed something because it's just not. Every woman, middle-aged women I know are very wise. So why settle for less? If you waited all this time to be a parent, you're really going to settle for something less? You should shop for the best. And that really means, again, it's communication, communication, communication. If you don't have that positive feeling with your new doctor, then look around. Even if it means driving 10 more minutes, find that midwifery group or group of 3, group of 4. But it is so important because I tell you what, if you were to shop for a dress, are you really going to settle for something less than you want? You say, oh, you know what? It's a little too short for me. Oh, it's not the right color. It's the wrong shade of blue or wrong shade of gray. So you're going to settle for less? Why should you? One of the things that really stands out for me when I see older mothers, I think, is patience. It's something that is so lacking in younger parents. But older parents, mothers, they are so patient. So many of them want to do breastfeeding. They want to just provide the right meals for them and whatnot. And how does it happen unless you're patient? And it really, if there's one quality I see clearly that separates, it's patience.